the digital experience has become an integral part of our lives, and nowhere it is impacting more profound than in healthcare. Today, we have the privilege of delving into the very essence of digital transformation in real worlds and in practical world. And who better to guide us through this journey than the visionary himself, Mr. Vishnu Saxena, the founder and CEO of Digital Health News and ScaleHealthTech. With his expertise, we are about to unlock the keys to digital transformation. We will explore how to build a digital strategy and which not only transform healthcare but also paves the way for an enterprise-wide transformation to the health system. So let's ignite our curiosity and understand the power of digital strategy to transform healthcare organizations. Ladies and gentlemen, please join me in welcoming Mr. Vishnu Saxena to the stage.
Good afternoon. Back again on the stage. Wonderful insight by the esteemed panel on the cybersecurity. So a big round of applause for Arvind, Kumar, Manage Engine, Dell, and the hospital executives. Apologies for missing the name. Now I'm wearing a different hat right now. So I'm taking a hat off my ScaleHealthTech. It's a strategy session. It's a digital strategy discussion, and this is something that I have been doing a lot over the last 14 years. And this is the topic that we practice within the company of ScaleHealthTech. And so the topic is, when we are talking about innovation, investment, and digital transformation, so the question becomes, when we talk about digital transformation, how and where you want to start? Now, every organization, whether it is US, India, UK, Australia, anywhere, every organization, every health system is trying to do something digital, right? And doing digital is not a question of if, it's a question of when. And it is not a choice anymore. Either you do it or you left behind, right? So the question becomes, what does digital transformation mean, and how you want to make that happen in your organization, right? So the topic that we are going to talk about is from doing to being digital and building digital transformation strategy. So as you know, I also run a boutique health IT management consulting firm called ScaleHealthTech, which is based in Atlanta, Georgia. So the experience that I learned over the last 12, 14 years, and that's what I'm trying to bring it to the audience here in a contextualized manner which is tailored to our audience here. Now, I want to give you two perspectives. A, the consumer perspective first. Why we are even talking about digital strategy, right? Why we are even talking about digital transformation? Who's driving that? Who's asking for it? So there are two aspects to it. A, the consumers, aka the patient, all of us. And then I will talk about the hospital perspective, what they are trying to address towards that ask. So if you see carefully, so the patient, aka the consumer, is the convergence point of the digital transformation. So in the center is the patient, we, us. And imagine a hospital organization structure for a second. You will see on the left-hand side, Chief Marketing Officer, Chief Operating Officer, CEOs. You had the panel, the CEO panel. These are their objectives. They want to have a 360 degree, not only 360, 720 degree view of the patient. They want to do, branding. They want to do social media engagement. They want to do, lots of NPS score and all. There are certain terms which may not be relevant here, but then, they want to, the business stakeholder in a hospital, what their objective is. They want to acquire more patients. That's the single most important thing that they want to do. They want to retain the patients across their journey. They want to engage existing patients. They want to engage new patients. They want to attract more patients. So that's the business objective that the hospital business stakeholders have. Now, on the service and operations side, they want to talk about, omni-channel experience, frictionless, across the channel. call it, click it, walk it. Personalized care, care management, telemedicine, virtual care. So if you see on the left-hand side, these are the business stakeholders. Their focus is on that patient is following. On the right-hand side, I apologize, on the left, extreme left. On the extreme left-hand side, if you see the CIO and the CTO drivers, the focus that Arvind, Kumar, and likes of the Arvind and Kumars, they want to generate insights from the data, right? When we talk about engagement and experience, it is driven by data that unlocks the engagement and experience. Digital health innovation, portal, mobile apps, gamification, emerging technology, innovation center, venture fund, we all talk about that. These are like the CIO and the CTO focus and drivers. IT delivery and infrastructure, the CISO, the CTO, the infrastructure is a key enabler, right? Digital ecosystem, secured infrastructure, cloud enablement, API. So all that underlying infrastructure that essentially helps that digital strategy. So if you see the patient, aka consumer, is the convergence point for the digital transformation. Now, what exactly is happening is, from the consumer point of view, we all of us, the way we shop, the way we travel, the way we bank, so we are used to of it. You know, Myntra.com and Flipkart, you name it. Blinkit. I learned about Blinkit in India. I mean, 7 minutes, things are at your home, right? For a second, can you think about it? If you want to make an appointment for a hospital, are you able to do it? Or your primary care physician, your trusted doctor, who you know, can you make an appointment? You have to call or something, hey doctor, I got something, WhatsApp, something like those kind of things, right? So we all of us are used to of consumer centricity, great experience in our different walks of life, banking, travel, shopping, whatever. And we are bringing those expectations in healthcare. And we are demanding the same experience in healthcare. So I want my care to be accessible anytime I want to be able to see the doctor. It has to be connected, right? It should not be like disjointed, right? Hassle-free, shouldn't be, it should be easy. Covered, it should be covered, insurance, whatever the mode of payment is for that individual, it should be. Personalized, very important. So personalized is something that, when you bank, when you shop, it's a personalized experience, right? Like Zomato sends you lots of text. This is the time to do the breakfast. Can you order something? So I'm sure you all use Zomato, right? And can you imagine the kind of text that you receive on your mobile phone? It's time 7 p.m. Dr. NKJ, would you like to order some food, right? So that's very personalized to you. Can you imagine the hospitals sending you the text reminder about your upcoming appointment and all those kind of things, right? So there's a changing expectations by all of us, and we are demanding the same thing from the healthcare. Now, I'm going to talk about consumer experience for a second. Consumer experience is the king, whether it is Amazon, Flipkart, Zomato, or whatever it is, Uber, and in healthcare also, Mumbai, Bangalore, any parts of the India, is very competitive. I mean, hospital A, hospital B, hospital C are eyeing for the same patient. Now, how a patient will go to hospital A and why a patient will not go to hospital B depends upon the kind of experience they get it, right? So if you see the hospital that provides superior consumer experience generate 50% higher financial performance than average hospitals. It costs 5 times as much to acquire a new customer than to keep one. Increasing customer retention just by 5% increases profit by 95%. Is it too difficult to achieve? No, it's just needed some effort and focus. Consumer satisfaction score increases or decreases a hospital's NPS score, right? And that was the survey. What are the most important ways to differentiate yourself in your market to attract or retain patient experience? And what I call it these days, we talk about patient engagement. We talk about, we want to engage patient. But how? Experience is prerequisite for an effective engagement. Whether it is personal life, whether it is business, whether it's anything. Experience is the prerequisite for effective engagement. And modern experiences are shaped and defined by data. It's the data that unlocks the insights that generates great experience that translate into engagement. Now, that was the consumer perspective that we all are asking for, that we all are craving for. And we are asking our health systems, like hospitals, and they're listening to it, by the way. Now, coming back to the digital strategy, what hospital executive, the CEOs are asking. So the CEOs of a health system or a hospital in India, they're asking this question to likes of the Kumar, likes of the Arvind, that, hey guys, what does digital mean to us? If I'm the CEO of a hospital here or anywhere, and I want to start the digital transformation journey, I would be asking to my CIOs that, guys, what does that mean to my hospital? How do we see it impacting the present and the future? What kind of digital initiative other hospitals are doing? Am I getting left behind or what? How we can create a digital strategy, the final question. Now, if you see the forces driving the digital transformation in healthcare, COVID-19, of course, it has accelerated the digital penetration like anything, right? Everything digital. NHA compliance, we heard earlier, beautiful presentation, lots of things, and lots of research for NHA. They actually are the real catalysts right now in our country. Healthcare consumerization, access, experience, engagement. I just talked about it. Virtualized care delivery models, telemedicine, remote patient monitoring, all those kind of things is need of the hour. Hospital at home. Emerging data sources, health equity. We are a diverse country. Dr. Mashlekar talked beautifully about digital divide, digital access versus income, income inequality versus digital inequality. We are able to get the parity on the digital side, income side is still gap. That will happen over a period of time. Now, if you see the key objective for digital strategy, if I'm a hospital business stakeholder or the CIO, what are the key things comes to your mind? If you're all, let's say, half of you are the hospital CEO or the CIO or CEO or the COO, and half side are the CIO and the innovation leaders, what comes to your mind? Why we are doing that? We want to acquire, engage, and retain more patients. We want to empower our clinicians and physicians, nurses, staff. We want to reduce the cost of care delivery. There are lots of leakage. Dr. NKJ can attest to that. There are lots of wastage in the hospital business. Lots of. The larger the hospital chain is, the more the leakage and seepage are. So these are the key drivers when we talk about creating a digital strategy, creating the digital transformation roadmap journey, right? Now the question becomes, everything is good. Where and how we start? Creating a mobile app, throwing on the patient population is not the solution. You can create a mobile app. You got lots of pressure. The CIO is under pressure from the CEO. That hospital across the road is having a mobile app. We don't have anything. Hey, create a mobile app. We need to give the mobile app to patient. Okay, they did it. It started driving a little bit engagement, but that is ad hoc. That is like putting a bandage. Need of the hour is okay. I mean, you address that mobile app, that's okay. But that is ad hoc, an approach that's not an enterprise-wide. When we look at digital strategy, when you start the journey of digital transformation, you start with the vision of where my enterprise strategy is. What is the hospital's business strategy is for this year, for the next year? Are we going to open more hospitals? What is the percentage of the patient retention? How many new patients? How many beds? What's the utilization? so on and so forth. So when it comes to digital transformation strategy, this is the framework. It is not a prescriptive, it is a descriptive. You can slice and dice, and you can use in your own context. It is not that you have to use this framework only. So the question is, where does digital strategy in the enterprise vision something that we have to think about it? So if I'm the CIO, I will go to my business stakeholders, I will go to the CEO office or the CEO office, I will try to understand, of course that charter I will have anyway. So I'll try to understand where does digital transformation fit into enterprise strategy. Digital strategy cannot be in stand alone. It is not a piece of paper that can live in the CIO office. The digital strategy is a piece of paper that is imbibed into the enterprise strategy vision. What are the goals and objectives of a digital strategy? I can create a digital strategy, but what are the goals? You have to define that. What are the risks of not executing on digital transformation? If I don't do, what I'm missing out? Now, after you laid out the digital strategy vision and that is aligned to your enterprise vision, then you do readiness assessment and benchmarking. What does that mean? What are the current digital initiatives in flight? For example, I give an example. Hospital is already doing a mobile app development, a patient engagement mobile app development. They are already trying to do. So that is one initiative in flight. You have to consider that. But that is not the part of strategy. What benefit these initiatives have delivered? So you have to question, there are certain things that we are already doing, have done, have they produced any patient and the business outcome? You got to measure them. How do current initiatives compare to industry benchmark? Okay, I'm a reputed hospital chain. I have done certain things, engagement app, digital front door, some AI automation. But is it with an industry benchmark? Or is it current? Right? So that's where we do the readiness assessment and benchmarking. The third is, which is critically, once we have laid out the digital strategy vision and we have done some assessment, then we are in a position to do roadmap development. What is the universe of digital opportunity areas? Digital transformation is a two-word, but it's a very big tent. There's a whole lot of universe within that digital transformation universe. Engagement, experience, AI, automation, EMR, EHR, telemedicine, remote patient monitoring, hospital at home, CRM, mobile app, you name it. There are tons of them. So you need to see how they map to some of the key areas, like for example, engagement, patient engagement, caregiver, like caregiver enablement means nurses enablement, or organizational efficiency, how they are mapping across certain key areas. What is the expected level of investment? So you need to see the budget. The CFO will ask you the question, okay, looks great piece of strategy, what you're asking for, how much it takes. So you need to see the investment commitment from year 1 to year 3. Because the outcome of digital strategy and transformation in hospital does not come in 6 months or 1 year. It comes maybe the second year or following year. Now, after you have done an assessment, you have to see what is the correct prioritization and dependencies. You identified, let's say 3-4 areas. We need to do patient engagement, we need to adopt AI, we need to implement our EMR, EHR, we need to improve that, we need to do some cybersecurity stuff. You can't do everything in one go, all right? So we need to do the prioritization. What is the right prioritization and sequencing of the digital roadmap opportunity? So you created a roadmap, right? But you have to identify in this quarter or in this next 6 months or this year, we will do these things. So that's the prioritization, right? Then what is the business case for each digitalization efforts? I was working with a large health system in Colorado a couple of years back. And Fabi and Neil, they opened up the RFP. They wanted to create a patient engagement app. And We made the presentation, we got, long story short, we got through, we were a finalist, all those things were done. 2-3 weeks later, we got to know that RFP was scrapped. And I talked to CIO, what happened? The answer was the business use case was not done. And the CFO and the CEO wanted to ask this question, I'm going to spend this much of money, where's the ROI? So the CIO got a little proactive, but the business use case was not done. So they scrapped it for some time. So the business use case is equally important, even if you identify that these are the things that we want to do, because CEO will ask question that what is the piece of ROI? Where's the patient and the business outcome? What are the major technical dependencies? We have, every hospital has certain development capability, certain technical capability, but not all. So we need to do that assessment. What is the level of technical debt? How much technical debt I have? How much I will accrue more if I do that? So we need to do that prioritization and dependencies. After that, operating model and funding. That's very important. What is the optimal operating structure to deliver on this strategy? A strategy, beautiful strategy, sometimes you can engage some consulting partners, some external forces, external vendor, whosoever that partner is. But then, what is the operating model to deliver on that strategy? What is the governance structure? Okay, now we are going to embark on a journey, let's say, sometime EMR implementation is a complex, complex journey, and it takes lots of bandwidth. Many of the hospitals, they say, when it comes to digital transformation, EMR implementation is their digital transformation initiative. In essence, it is, because ultimately they are consolidating everything. But then, what is the governance structure? So you need to constitute the right set of the team. Leader, director, manager, program manager, all those kind of things. What is the funding structure and funding sources? Do we have the funding? Does the CIO has those funding structure or not? The final technology platform and the partner selection. Now everything is done, but do we have internal capability, buy versus build? Right? What are the key skills to be developed in-house? We may have certain capability in-house, we may not have many capabilities. Who are the strategic technology partners to execute on this vision? Whatever the initiative that we are planning, do we have those partners? Because a hospital in India or even if the tier 1 hospital, they may have certain capabilities, they may not have all the capabilities. So we need to assess who are the strategic technology partners who will help us ride with us on this journey. What is the role of internal development teams? We may have some internal software development team. How many people are equipped in doing certain app dev and all those kind of things? So the idea is, it is a phase-based approach. Phase 1, we do the digital strategy, the vision. Then we do readiness assessment. Then we do the roadmap development and prioritization. And then the execution is phase 3. So that is the framework that I would like to recommend, and my time is up. I would be happy to discuss with all of you a lot more. This is one of my favorite topics. I can go on and on. I'll do this for a living. And so for example, just to give an example, digital strategy readiness assessment. So when we do the assessment, so in 3 categories organization fall into. One is digital pioneer, they are great. Digital follower, okay type. Digital opportunities, they are still trying to understand what the heck is going on in the world of digital and what I can do. This is an area, let's say you identify that, this is the patient engagement is something that I want to do in this year. What does that mean? What does that mean, patient engagement I want to do? Means I want to provide better patient education. I want to provide better patient access. I want to provide better patient care model. And these are some of the examples that digital opportunity presents. I want to create a mobile app that has a symptom triage. I want they be able to do the eligibility verification, coverage discovery, cost optimization, education tools. I want to have that mobile app that has a digital front door, of course, frictionless, call it, click it, walk in. Customer relationship management, I want to do the CRM, appointment scheduler, transportation. Many of the appointment that we miss, the no-show that happened in a hospital, because elderly people, they're not able to go to the hospital. You can provide them Uber, Ola, whatever. Provider matching, real-time, finance, kiosk check-in. There are lots of things that you can do. I just wanted to put an example. So the point is, the future of healthcare delivery organization will be not digital. They will be digital. They will not do digital. They will be digital. So that's my closing thought. Thank you.